take something that would make you feel better and look better and perhaps make the aging process a bit easier to deal with.
Now that sounds good. Tonight in a special report, Karen Abernathy looks at what somewhat controversial therapy, some would say, but a lot are saying it's changing their lives for the better as they search for the fountain of youth.
Well, we all want to feel and look as good as possible for as long as possible. Unfortunately, over time, that gets a little more difficult as our bodies and minds start declining a bit. But more and more people say they are getting their lives back thanks to bioidentical hormone replacement therapy. Celebrities like Oprah Winfrey and Suzanne Summers are among those touting the benefits, and it's catching on. It may not be the fountain of youth we dream about, but for some, it's life-changing. 41-year-old Crystal Moran of Lyman loves spending her free time enjoying the great outdoors with her husband Carrie and their 4 quarter horses. Riding and taking care of their horses is one of the passions they share. But it wasn't too long ago that Crystal wondered if she had lost that passion and the overall feeling of joy it brought to her life.
I kept telling myself I'm okay, it's going to pass, and never did.
She says she was on a dark path she had never experienced before, and it all started after her hysterectomy 3 years ago. It was affecting her quality of life in a drastic way.
The feeling of not having a good sense of where you're going to be tomorrow. You felt like sometimes you just want to get in your car and drive and not go home because the feelings were so bad.
Her doctors prescribed synthetic hormone replacement therapy after her surgery to help her deal with the hormonal changes she was suddenly going through, similar to what women experience when they go through the more gradual process of menopause. But she says they didn't help. After the surgery, she didn't have any energy, experienced significant mood swings and depression, and started gaining weight. Then she started doing research on bioidentical hormone replacement therapy, which brought her to anti-aging specialist Dr. Victor Bazone.
Happened to run across an article on Dr. Bazone in a magazine and showed it to my husband. I said, well, it's worth a try.
Dr. Bazone is a well-known neurosurgeon on the coast who recently discovered the benefits of BHRT himself and wanted to offer it to others.
I've been on testosterone replacement now for almost 2 years, and it's made a world of difference in how I feel, how I act, etc.
Dr. Bazone says hormone levels start to decline in women and men in their 30s, and by the age of 40 or 50, both sexes are likely hormone deficient.
Once you reach 30 years of age, you start losing hormone production in your body at the rate of about 1.5% per year.
His patients go through extensive lab work, checking blood for things like estrogen, progesterone, and testosterone in order to develop a tailor-made bioidentical formula depending on the patient's individual needs.
If you prescribe hormones for a person without testing them for their deficiencies, you really don't know what they need and nor how much of it.
Crystal's lab work showed tremendous hormone deficiencies, particularly in her testosterone levels. But within only a few weeks after beginning BHRT, her life started turning around. Balancing her hormone levels has given Crystal her life back.
I have my energy back. I feel 100% better, losing weight. I'm enjoying things again like I used to do, and I don't feel like I'm in a dark place like I did before. It's overall just been 100% turnaround for me, and I'm so glad that I finally found something to help me.
She hopes sharing her story will help other women and men who she says may be suffering needlessly like she was, and encourage them to have their hormone levels checked so they too can reclaim their lives.
It just overall makes you happier, and I think, and in the end, that's what we're all looking to be, and it's doing that.
It has made a huge difference for her, even helping her skin and hair. She says they both look better. Now, Dr. Bazone's patients start BHRT usually in their 40s and 50s, but he says it's never too late to experience the benefits. Tonight at 6:30 on WLOX CBS, we'll hear from another Coast woman about how BHRT is helping her later in life. And of course, while many are touting the benefits of BHRT, the FDA has not given BHRT its stamp of approval, saying there is insufficient evidence that bioidenticals are any safer or more effective than the synthetic versions. Jeff and Rebecca?